Good evening, Missouri City. Welcome to the Tuesday, August 24th COVID-19 news conference. I'm your mayor, Robin Ellicott. As you know, the pandemic has reached yet another critical point. All segments of our population are being impacted by this virus. We are seeing an increase of positive cases across all demographics, including vaccinated and unvaccinated groups. We are seeing children, adults, and seniors being hospitalized at an alarming rates. We're also seeing schools and businesses return to a virtual education and engagement business model. Our local medical facilities have reached a capacity, and our frontline doctors, nurses, and hospital staffs are working around the clock to save lives and to stop the spread of this deadly virus as much as possible. With that said, please understand that our healthcare professionals and facilities are spread thin, and we need your help to combat the new variant of COVID-19 virus. This is very important, especially because the economy is fully open and schools are back in session. I would urge you to practice this and be proactive, to get vaccinated if you haven't done so, to wear masks and facial coverings when in public and in common places, to wash your hands frequently, to use hand sanitizers as needed, and to clean workspaces and other frequent used spaces as often as possible. And to visit a doctor if you or a loved one is experiencing COVID symptoms, such as fever, nausea, coughing, headache, shortness of breath, or difficulty breathing, congestion, or a runny nose, and new loss of taste or smell. In addition, your city officials and staff are still working tirelessly to protect the well-being of our citizens, stakeholders, and staff. All city offices are open to the public for business. We are still monitoring updates on the pandemic. We are still observing public health safety guidelines, and we are still partnering with our local health leaders and authorities such as Joe Anzandua to make business decisions based on the medical data. For our discussion today, we are going to be joined by Dr. Joe Anzandua, Dr. Mona Finley from Glen Lake Pharmacy, and our Fire and Rescue Services Chief, Mario Partita. We'll also have our standard Q&A sessions at the end to make sure that we answer all of your important questions as well. So if you're seeing this at home right now, please go ahead and enter the question that you have under the comment section, so that way either myself or both of the doctors or our fire chief can answer those questions for you. Thank you again for your continued support and partnership. Now I'd like to introduce Dr. Joe Anzandua, who has some important information on vaccines, rising cases, hospitalizations, and recommendations for schools and businesses and more.
Good evening, Missouri City. Honored to be here. I'm going to touch upon a lot of things because there's a lot of things going on regarding COVID-19, so just bear with me. I'll try not to get too wordy with the numbers, but there's some data that I feel compelled to give you. About 60% of the total U.S. population have received at least one dose of a vaccination, and about 50% of the population have received both. Numbers of vaccines have decreased slightly from the previous week, but up overall since last month. That's going up slightly, so that's good. The number of children hospitalized in this country are now at an all-time pandemic high, though children currently make up about 2.4% of hospitalizations. That percent is expected to climb. In Fort Bend County, on August 11, 2021, Fort Bend County announced that it was raising the county risk level from orange, which was moderate significant, to red, which is high community risk. Fort Bend County judge stated that a mask mandate was being reissued for county buildings, including schools. Due to ongoing litigation between local government entities and the state of Texas, this has caused some confusion and challenges with respect to our local school districts as well. So in general, cases and hospitalizations continue to increase in our area, like the mayor said, and although deaths have increased, it has not been to the extent that it was July of 2020 or even January of 2021. No doubt this is because of the impact of vaccinations, as well as more awareness about mitigation strategies, the 3 W's that I've discussed in the past. So in general, cases have been increasing in our area. Over the last week in Fort Bend County, there's been an average of 411 new confirmed cases per day. Overall, last week, Fort Bend County has averaged 2 to 3 deaths per day. And since March of 2020, the Fort Bend County website is reporting that there have been 780 deaths. Percent vaccinated people, 64% of people in Fort Bend County have received at least 1 dose. About 57% have been fully vaccinated. So anybody who is at least 12 years old is eligible to be vaccinated. Severe adverse reactions are still being reported as rare. Hospitalizations, we have about 87% adult ICU beds. 28 of those are being filled by COVID patients. So overall, 77 out of the 87 available ICU beds, that's 88% are filled. The medical center, the number of daily average hospitalizations at the medical center has hit an all-time high and probably the highest level since the beginning of the pandemic. Currently, 1,446 ICU beds are being occupied, making up about 85% of the Texas Medical Center's total capacity. With respect to pediatric admissions, this has gone up due to COVID-19. Although children are much less likely than adults to develop severe COVID-19 illness or even die from the virus, recent data from the U.S. Department of Health and Human Services is showing a substantial increase in pediatric hospitalizations for COVID-19 compared to a year ago. This surge is due to the surge in Delta variant cases and the fact that there is still a large pediatric population that is still not eligible for a vaccination, and those are the people less than 12 years of age. So children less than 12 years of age are not eligible for vaccination, and only about 30 to 35% of adolescents greater than 12 years of age are fully vaccinated. So this underscores the importance of universal masking in areas where the transmission of the Delta virus is high, such as our area, and this should be strongly encouraged still. Yesterday, Pfizer COVID-19 vaccine became the first vaccine to get full approval of the FDA. The vaccine had been approved for the prevention of COVID-19 disease in individuals 16 years of age and older. So it's been approved for that age group. The vaccine will continue to be available under EUA, or Emergency Use Authorization, for those ages 12 to 15. So if you're over 16, it is fully approved. Pfizer's vaccine will also still be under EUA for immunocompromised individuals who qualify for a 3rd dose of the vaccine 28 days after their 2nd dose. Full approval is expected to encourage more employers and institutions to require vaccinations. They did a study recently that showed that the major reason why people were not getting vaccinated was because they were waiting for the FDA to give full approval. Well, that's happened. So it's expected, and I expect to see an uptick in vaccinations. So it's expected that the people who were once reluctant to get a vaccine hopefully now will get vaccinated, noting that there's confidence in doing that. It's also expected that the FDA will give full approval to Moderna vaccine. The Johnson & Johnson vaccine, they have not yet applied for full approval, but I'm sure it's expected that they will do so in the near future. So people can feel very confident that this vaccine meets the high standards of safety, effectiveness, and manufacturing quality that the FDA requires of an approved product. It is also expected that the Department of Defense will require the country's 1.4 million active duty service members to be vaccinated. It's still unclear, however, how they're going to handle those people that received the Moderna, since the recommendation is still to stay within the same brand. Regarding the third dose of the messenger RNA vaccines, that's the Moderna and Pfizer, on August the 12th, the CDC recommended and approved by the FDA that giving an additional dose of COVID-19 vaccine from Pfizer in moderately or severely immunocompromised people who are 12 years and older, or the vaccine from Moderna in immunocompromised people aged 18 years and older was recommended. So the eligible people wouldn't require any documentation or prescription for a third shot and would be able to declare their eligibility at any site where vaccinations are administered. CDC recommends that people receiving the third dose try to get the same vaccine as their first 2 shots at least 28 days after receiving the first 2 doses or the second dose. If someone who is immunocompromised isn't able to obtain the same shot as their first 2, then they can mix and match messenger RNA, but again, that's a second option. Immunocompromised people who received J&J vaccine aren't currently eligible for an additional messenger RNA such as Moderna or Pfizer because there isn't enough data to support such a recommendation. Please note that the FDA has recently approved the third COVID-19 vaccine dose for those who have compromised immune systems as part of their primary vaccine series. In other words, this third dose is not considered a booster. It's still they're making it part of the primary series. So instead of a 2-shot series, it is now a 3-shot series. With respect to nursing homes and the effectiveness of our current vaccinations in the prevention of COVID-19, recent data from the CDC is showing that there's been a significant decline in vaccine effectiveness against COVID-19 virus in nursing home residents, as a highly contagious Delta virus is causing a spike in hospitalization, and mostly among unvaccinated Americans. So it appears that additional doses of COVID-19 would benefit nursing home and long-term care facilities. With respect to the booster shots, on August the 18th, the U.S. government announced that it was prepared to support and offer booster shots for all Americans who received 2 doses of the Pfizer or the Moderna COVID-19 vaccine beginning the week of September 20th and starting 8 months after an individual's second dose. A recent study done in Israel suggested that a booster shot of COVID-19, the Pfizer vaccine COVID-19, could significantly improve immunity in those aged 60 and above. In this study, the booster shot reduced the risk of infection in the 60-plus age group by 86% and against severe infection by 92%. The CDC has still not made a final decision on this, as it's requesting more input and deliberation from other experts. So no decision has been made on the Johnson & Johnson vaccination. So, while it appears that some vaccinated people may benefit from a third dose, it should be remembered that about 40% of Americans have not been vaccinated at all, despite new COVID-19 cases and deaths surging across the country. So 60% of vaccine-eligible Americans have now received at least 1 dose. People are not considered fully vaccinated until they have received both doses in the case of Pfizer and Moderna. What is important to remember is that the only way to contain and eventually stop this pandemic is for more people to get vaccinated. With respect to the status on mask mandate in school, due to ongoing litigation, it is still unclear whether school districts can mandate students, teachers, and staff to wear masks. And I recently learned that Fort Bend ISD voted 4-3 last night at their board meeting to require masks. I can't confirm that, but that's what I've been told. Also, on August 19th, the Texas Education Agency, the TEA, updated its public health guidance and has stated that it will not prevent schools from enforcing mask mandates in defiance of Governor Abbott's GA 38 executive order. One final point, I told you earlier that the county has gone to red, which is the highest community risk category we have. Well, what does that mean? Well, that means that they are asking for people to avoid all gatherings of any size, to avoid non-essential business and personal travel, to avoid public transportation where possible, practice good hygiene and social distancing, the 3 W's. Cancel visits to nursing homes and long-term care facilities and even hospitals. Thank you for your time.
Thank you, Dr. Joe Anzandua. That's a lot of information, and I get it, but please take the moment to, if you're watching this, ask those questions under comments, and if you're watching this later on tonight or tomorrow, go ahead and ask those questions, and we will try to get those answers for you. So right now, I have Dr. Mona Finley with Glen Lake Pharmacy to talk about the vaccine and some of the rising concerns that she has.
Hello, Missouri City. Dr. Anzadul's covered a lot of the vaccines already, so good news. Pfizer has been fully approved by the FDA. It's no longer in our EUA status. As of August the 13th, FDA and CDC authorized a third dose, which is a booster, but really a third dose, of Pfizer and Moderna for immunocompromised patients immediately. Also, anyone living with someone who has a weakened immune system is eligible to receive the vaccine at this time. If you have concerns or questions about if you meet the criteria, please don't hesitate to give us a call. The general population will commence their third dose on September the 20th, essentially 8 months after their second dose. There is no booster currently for J&J, and we cannot cross over different manufacturers at this point in time. We have come a long way since the start of the COVID-19 vaccines in December 2020. Vaccines are more readily available. Here at Glen Lakes Pharmacy, we have worked countless hours in vaccinating the community for all of our protection. We have ample supply of Pfizer and Moderna vaccines on hand, and we are vaccinating every Monday, Wednesday, and Friday. We do take walk-ins. You can also make an appointment by going to our link. Be sure and bring your vaccination card when you show up at the pharmacy. Our link can be located on the City of Missouri City website, or you can go to tinyurl.com/GLP vaccine. Thank you.
Thank you, Dr. Finley. I just want to let you know that I had the opportunity to take my own COVID shots with Dr. Finley at Glen Lake Pharmacy. And I had my own questions and my reservations around whether I should take this or not. So I had the opportunity to discuss this, my own personal matter, in private with her and allowing her to educate me. So even if you're thinking of taking, and if you're not 100% sure, I would urge you to just visit with her or anyone else in the county, and they can explain to you the importance and get you educated. Next, we have our Fire Chief, Mario Partida, with an important announcement.
Thank you, Mayor. I want to give you an update on our current condition or status from Fire EMS, first responders, as well as our Emergency Operations Center. Our EOC, or Emergency Operations Center, remains on standby, and we are constantly monitoring the situation, and we communicate often with our community partners like Fort Bend County and our neighboring fire departments. Fire and EMS operations remains constant. We have reviewed our protocols and updated our response protocols. Your personnel, your fire and EMS response personnel are still responding and are guarded out there, so you'll still see them operating in masks, safety glasses, and depending on the call type, you'll see them in gowns as well. We've been increasing our support and care for our firefighters in the stations with routine cleaning and disinfecting of the stations, as well as temperature checks and encouraging distancing and masking. We continue to offer vaccinations to our fire and EMS personnel, and we follow our infection control protocols in the event one of our firefighters becomes ill or exposed or infected through the guidance of Dr. Joe Anzadua, our medical authority. I want to share a couple local statistics for Missouri City. The current COVID cases in Missouri City as of this week was 761. They're reporting also that fully vaccinated residents are at 64,753, and partial or or vaccinations, partial vaccinations at 6,572. As regard to community support, we continue to provide the most recent information through our communications department, so please visit their website. We have an abundance of PPE kits that are still available, and we provide them on demand, and we also distribute as many as possible at every event that the city manages or oversees. We are focusing our efforts on seniors and senior living centers, and so we remain in contact with those centers, as well as group homes. And for any additional needs, please don't hesitate to call 281-403-8500. Again, 281-403-8500, or check the city website for the most recent information. Thank you.
Thank you, Chief Fertitta. And thank you all for watching. These discussions will be continuing, moving forward with the help of our City Council and myself to keep everyone informed on COVID updates, so this way we can protect our community at large. Now this is an opportunity for Q&A. So again, we have some questions that came in prior to us going live with this news conference. But if you're watching at home and you are not, you have a question that you want to ask myself, Chief Fertitta, Dr. Finley, or Dr. Anzaldúa, please more than welcome to go ahead and write those comments, so this way we can get to your questions. And even if you missed this, if you're watching this tomorrow or day after tomorrow, if you have questions, go ahead and write those questions under the comments, so this way that we can get back to you with those questions. We'll go ahead and take those questions right now. Yes, so the Fort ISD have taken the vote of 4-3 to allow, to mandate mask, I should say. And these mandate will go into effect sometime later this week, or you should see from any of the Fort ISD outlets, if not a letter or something to you directly regarding what that was. And again, I believe that they're following the CDC guidelines. But if you have questions in regards to Fort ISD's decision, I would urge you to contact your Board of Trustees. If not, contact Fort ISD directly, and their contact number is 281-634-1107. 281-634-1107.
Also, Mayor Ellicott, City Council and staff just launched a great major branding initiative at the State of the City to encourage residents to eat locally, play locally, and shop locally. Are there any COVID guidelines residents and businesses should be sure to follow as part of this important marketing campaign?
Absolutely. So, we took that on, that program as a campaign to reach out to our community, especially during State of the City, to talk about a campaign that's to eat local, shop local, and play local here in Missouri City. Now, when it comes to the question of, the protecting yourself while eating local, shopping local, and playing local, I would urge you to, if you're at the restaurant or businesses, the visitors, please abide by the guidelines that are set by each restaurant. And if you're not comfortable, please get with one of the staff at the restaurants and talk to them about, the protocols and the guidelines that they have in place. And then also practice social distancing. And I'm sure, these places have hand sanitizers and things that are put into the measure to protect you from that. Now, as for playing local, two of the sites that we have are golf course, Coal Valley Golf Course, and then our rec center. Yet again, we as a city, and these are city facilities, we have put in those measures of making sure that hand sanitizers and social distancing and all those things are in place. But again, if you're uncomfortable with whatever it is that you're seeing, please get with a staff member or please get with one of the people who are running the facility and to talk to them about your concern so that way we can put these things into place. And especially at rec center, when exercising, and I know there's sweat and there's things like that, so we have put in measures to wipe things down. But yet again, if you're not seeing something like that, I would advise you to stop at the front desk and talk with one of their staff so this way that they can take care of those things.
We have a question for you. Can you remind our viewers what age groups are eligible for the vaccination at this time? And is there a difference in the type of vaccinations that are given to youths and those that are administered to adults?
Sure. There is no difference between the vaccines for adults and adolescents at this time. Pfizer is for ages 12 and up. Moderna is from 18 and up.
So what specific age groups again, as a whole?
As a whole, Pfizer, we can vaccinate ages 12 and up, and Moderna, ages 18 and up.
So if you're 12 and older, you're eligible for the vaccine at this time?
That is correct.
And what about children younger than 12?
Younger than 12, it has not been approved just yet.
Thank you. And is that in the works? Are there discussions?
They are doing studies right now for children younger than 12. However, it has not been approved at this time.
And so parents who feel like their children younger than 12 or, caregivers are having COVID symptoms, what would you recommend that they do?
If they're having COVID symptoms, I would definitely go and see the doctor.
Thank you. Chief Partita, we have some questions for you as well, sir.
Yes.
Chief, can you remind our viewers if Missouri City, our EOC, has received any new COVID-19 orders from Fort Bend or Harris County?
We have not. We're still following the governor's orders and remain in contact with the county, but no new direct orders from or directives. They oversee the county buildings and we oversee the city buildings.
And how would new orders be communicated to the citizens and stakeholders should they be received? Where should people look for that
The
information?
website. So go to the city's platforms and the city website to get the most recent information.
And that's www.missouricitytx.gov.
Yes.
Yes, thank you. Also, can you share whether or not the city staff is still distributing PPE supplies to the community and how people go about requesting it?
City staff is we still have PPE kits available. The kits include sanitizer, gloves, and other amenities in one packet. And so they're family-sized packets that we can provide on an on-call basis. So you can call 281-403-8500. We are also making those kits available at every event that the city holds and sponsors. So you'll see those available at every meeting or any event.
And Fire and Rescue Services has done great outreach throughout the pandemic, especially for seniors. Can you talk about whether or not you're still delivering to nursing homes and assisted living facilities and whether or not that's still a special focus for the city?
It is our focus. Seniors are our focus in the senior centers. So we are in contact with any issues that arise in those areas or those locations. But again, we're available for them to call us. We do get calls occasionally for needs, and so we will hand deliver or make available any of our services or our PPE kits.
And those special needs facilities had been a major issue initially during the pandemic. Are we getting any reading on that right now with the variant?
We have not had any reports of issues with senior centers or group homes.
One other quick question, Chief. Can you talk about city staff and whether or not we're fully vaccinated or what the status of that is internally?
Pursuant to the executive order, the governor's executive order G838, we cannot require people to disclose whether they're vaccinated or not. But the city does encourage city employees to get vaccinated.
Dr. Zua, we have a question for you as well, sir. You talked about a lot of comprehensive information on COVID cases, the impact of the variant. Can you talk about the reports that you provide city staff and if those will be coming more frequently given the increase with the variant and how that works through your office?
With the staff respect to,
Providing reports to staff to share with the community
Oh, yeah.
at large.
well, first of all, a lot of the information, we get from state of Texas and the U.S., the FDA, CDC, and of course our own county, Fort Bend County, and the medical center. So I tend to extract that information basically on a daily basis. If things don't change on a daily basis, I don't usually report that. I usually like to report when there's major changes that I think would be interesting for people to know and that impact people, whether it's a family, whether it's a business, whether it's city employees, whether, but anybody that would benefit from having that knowledge.
Professionals, doctors, nurses, hospital staffs being on the front line and impacted more than other populations all the time. How have you been impacted and how have you handled this whole COVID pandemic?
Well, it's been impacted in terms of working many long hours on a daily basis, but tough times call for this, and we just have to do our part. I will tell you that there are a lot of my colleagues who are in more harm's way than I am because they're dealing with, they're working in emergency rooms, they're working in ICUs. These people, to me, are the true heroes. They are on the front lines. So we all share in this. It is stressful, but I think we all do a good job. And it's just a matter of keeping everybody informed and keeping up to date on what's going on locally as well as nationally with respect to vaccinations and even to treatments, which, by the way, we do have some in there, and there's more coming. So hopefully this pandemic will end soon. The biggest thing I have that I'm happy about is that we finally got full approval by the FDA. Like I said earlier, a lot of people, when they were surveyed, said, well, what's the number one thing that's keeping you or hesitating you from taking the vaccine? And the number one answer was, I want FDA approval. I want to know that this vaccination has been fully vetted for safety, effectiveness, and quality. We have that. We have that as of yesterday. And I suspect that Moderna and Johnson & Johnson will soon follow.
We appreciate you. Dr. Finley? We have the same question for you. As a medical professional, been on the front lines, your pharmacy, first to administer vaccinations in the city. How has the COVID-19 virus impacted you as a professional?
Wow, a lot of long hours. As I mentioned earlier, we have worked countless hours on trying to get the community vaccinated. We have a very dedicated medical staff. We have doctors, we have nurses, we have pharmacists that actually administer vaccines, that monitor patients. It has been my duty to help out to stop the spread of the virus. The impact has been enormous. And the frustrating part in the beginning was getting the actual vaccines. But now, since we have a readily supply of vaccines, I encourage everyone to please come and get vaccinated. We're vaccinating first dose, second dose, third dose of both Moderna and Pfizer.
You have been very generous in your philanthropic outreach, wanting to make sure that special needs communities that wouldn't necessarily have access to the vaccine get access to the vaccine. Mm-hmm. Can you talk about that and why it's so important for you to have a wide reach throughout the community?
So we have patients that are in group homes, and Chief mentioned group homes and assisted living and nursing homes. We've actually gone out to some facilities. Some of them have come to us in vans, and once they pull up in the parking lot, our nurses go into the vans and administer the doses to them. Also in group homes as well. Some of them are mentally challenged patients, and they do not have have access to the vaccine. So we actually go to them, or they come to us and we go inside the van and we get them taken care of.
We appreciate you as well.
You're welcome.
Mayor Ellicott, we have another question for you, sir.
Yeah.
Will Missouri City continue to host community PPE drives?
Absolutely. So as the chief just talked about, PPEs, if someone's needing PPE, contact us through our website. If not, talk to us through our communication department, our Facebook, our Twitter. We can get those to you. Depending on the needs of the community, we will perhaps have another drive if we feel the need, that's too, but I will definitely check with, look at Fort Bend County, look at the initiative through our medical authorities, Dr. Joe Anzandua. So we will make sure that we'll connect with him before we take on another drive. But we also want to make sure that, we don't want to be out there where people are not coming because they don't feel the need to it, or they feel that they've been vaccinated and they don't need the PPE. So we're working towards that.
Mayor Ellicott, as you and City Council mentioned at the State of the City and talk about on an ongoing basis through your council meetings and other outreach, customer service with our residents and our businesses is very important, and we are open for business. As you know, the city has employees inspecting homes and projects throughout the area. Are those inspectors wearing masks when they conduct residential and commercial inspections?
That's a very good question. To answer that, yes, they should be wearing masks when they're out there in general public and trying to come to your homes. For some reason, if they're not, please, and if you don't feel comfortable, I would want you to make sure that you talk to the inspector and let him or her know to go ahead and wear their mask. You have every right to do so, and that's where we leave that with. But we would like to hear those comments and to make sure that our staff is complying with your request, and that's the most important. Our job is to make sure that you're safe. Your safety is our concern, and that's why we're making sure. Again, we're not mandating our staff to wear them per the GA 38 pursuant to the executive order by the governor. We can't mandate anyone to wear a mask, but if you are feeling uncomfortable, you can definitely ask to do so.
And as a follow-up, can you share what the city's position is when it comes to wearing masks in city buildings?
So again, as I just talked about, according to Governor Greg Abbott's executive order, GA 38 is what's known as. Due to that, the city cannot require people to wear masks. So if you're coming to our planning department or HR or a front desk, or even coming to a city council meeting, we cannot require, because of that executive order, we cannot require for you to wear a mask. So that's the order that we're following, as all cities do. We all have to follow that order. So that's where we stand behind that.
Chief Partita, we have a few more questions for you, sir. I know Mayor Ellicott just touched briefly on mask policies for city buildings. Can you talk a little bit more about the policy for employees?
Human Resources recently notified staff pursuant to the governor's order that they cannot require employees to wear masks. We do have masks available in our facilities so that if anybody wants one, or if an employee feels like they want to wear one, depending on who walks into the building, they're welcome to do so. But we do make the mask available, and PPE as well, other PPE.
And how are volunteers being managed in accordance with COVID-19 protocols?
When the city uses volunteers for various events or different events, we encourage them to social distance. We provide them an environment where they can do that, try to hold events outside. And then we also provide PPE for them to use if they wish. So we do provide that support when they're volunteering for the city.
Thank you. Can you talk a little bit about the deep cleaning of our city facilities and how often these deep cleans are being conducted?
So the city has a custodial contractor on standby that performs deep cleaning disinfecting, fogging throughout the city at various facilities. The fire stations have their own systems where they also disinfect and kind of disinfect the stations. So that is occurring constantly, and the equipment is also available for use on an emergency need. So we have equipment that the city owns to disinfect buildings as well.
And Chief, one last question. Is there any level of EOC activation at this time in regards to the pandemic?
There's not. The current Emergency Operations Center is on standby. Our emergency manager, Tramika Jewett, is constantly monitoring and staying in touch with county and state leaders. And so right now, we're just monitoring the situation closely.
What standby means? Tell us a little bit about, reiterate that
Yeah, so
standby
the
piece.
emergency operations is not staffed right now. So it is monitored by our emergency manager. And so she will advise or recommend city management on if there needs, on any regard to changing the status of the Emergency Operations Center. But right now, we're confident with staying on conference calls, staying in touch with our community partners and the county, with monitoring the situation and working with Dr. Zaldua to stay on top of all the stats that are coming in and to try to recognize if there's a change that needs to be made to the EOC.
Each of you leaders have mentioned today that this is a fast-moving pandemic. Variants are coming very quickly. Cases are rising. Hospitals are reaching capacity. Tell us how activation works and how well the city is prepared to respond in the event there's a very quick change again.
We have, the city as well as the fire department has a list of contingency plans. We were on a higher alert back last year, so we're ready to go to that mode if we need to. We're ready to activate at all levels of the Emergency Operations Center. So we have all those contingencies plans in place. We have enough equipment, we have enough supplies and staff to elevate our levels if we need to.
Thank you so much, Chief. We appreciate everything you do. Mayor.
All right, I think that's all the questions that we have. As I was just talking to Dr. Joe Anzandua about this, one of the things that he suggested as our medical authority is to stop the COVID completely, is to go ahead and take the vaccination. Now, to slow it down is where he had talked about in our previous conferences the 3 W's, which is to wash hands and watch your distance and wear a mask. That is only going to slow this down. But in order to stop this process, you would have to take the vaccination that's, per the medical authorities. And again, as you heard tonight, Dr. Mona Finley had also talked about the vaccination, and she's at Glen Lake Pharmacy. And as stated before, I got mine there, and I had some reservations around it, just like some of you at home. But I was able to get that education and get myself vaccinated to go through this process. We have run this COVID conferences several different times in the past before. We even had Dr. Mark Boom from Methodist Hospital System that was here, and also asking all of you to go ahead and take the vaccination as it's under SAFE. And today you heard that Pfizer, with FDA approval, as the doctor just talked about that, so that's there. So only thing we can do is ask you to get out there and be educated and talk to the experts and to make this happen. I want to thank our partnerships with Dr. Joe Anzandua and Dr. Mona Finley through Glen Lake Pharmacy, and also our FAR and EOC Chief Mario Partita, and the entire team for making sure that the citizens of Missouri City are kept safe, and we're doing everything we can to protect our citizens and our staff at all times. So that is our goal here at the city. And I know that for the past 2 months that we have not had any COVID-related news conferences, but moving forward and depending on the aggression of the Delta variant, we will come back to you and giving you much more information about what's taking place. So the takeaway is to please get vaccinated, wear masks and facial coverings. when in public and in common places. To, again, continue to wash your hands. We learn that all the time from doctors, and to use hand sanitizers as needed. And then also keep your workspace clean and neat. And if you feel someone is too close to you, the social distancing is still out there to protect yourself. Again, as a city, we can't mandate anyone to do that. But at the city facilities, as deep cleaning and everything else that we're doing to protect our staff and protect those who are coming into the city, those measures have been taken into consideration. As earlier today, you heard about the children, and then also seniors are the ones that being concerned right now, especially with school opening. Again, Fort Bend ISD, we heard they had a vote of 4-3 to go ahead and mandate masks. City's not, we don't control Fort Bend ISD, but you would have to contact your board of trustee, or you would have to contact the Fort Bend ISD administration to find out a little bit more details about what their decisions and what their wishes were. Once again, I want to take this opportunity to thank our county officials and county, especially our Dr. Minter and Dr. Joe Anzandula, Dr. Finley, and Mario Partita, and all of you who are watching, for making sure that we're doing everything we can to protect our citizens and our staff. If there are no other questions, we're going to go ahead and end. Thank you so much. Thank you for watching. May God bless you and stay safe.